What type of breast reconstruction procedures do I do after a mastectomy? I like to break it down into two categories, basically prosthetic reconstruction and then natural tissue reconstruction. When you're talking about prosthetic reconstruction, basically that's a breast implant. There's different kinds of breast implants, there's different grafts and so forth that we use around them. Sometimes you need extra coverage or tissue around it, but essentially the foundation of the new breast is created from the basis of an implant. And usually that can be a two-stage procedure, which is a tissue expander or a temporary device that creates a pocket, and that's eventually replaced with a permanent implant. When we talk about tissue reconstruction, we're borrowing tissue from another part of the body. My favorite place to do that is the abdominal tissue. Basically what we do is take the tummy tuck tissue, but instead of throwing it out, we take that and leave it attached to a blood supply and transfer it up to the chest. And that living tissue stays alive from your abdomen and goes up to your breast. The bonus is that you get a tummy tuck on the same day. The implant procedures are actually fairly minimal compared to the tissue reconstruction, but there need to be multiple stages to that, usually putting in an expander, then subsequently replacing that with an implant. The game plan in terms of discussing reconstruction with a patient is talking about the different options and how that might fit into their particular situation. Some people need surgery first and have reconstruction later. Some people are candidates for immediate reconstruction. This concept of being whole again, sometimes we can't establish that right away, and I make an effort to speak with those patients and let them know that there are other options like external prostheses and so forth that they can wear during their transition period until their cancer treatment is over, and then we can proceed with reconstruction later. But I'm wholly for that concept of feeling whole again. Some patients, when they come to me when they've just gotten their diagnosis, are emotionally distraught and have a hard time even deciding what they're going to do. Now, their general surgeon's already spoken to them and said, well, you have options about lumpectomy or mastectomy. They're just trying to understand the concept of cancer itself and what the different treatment aspects might be. So I think it's important to treat each patient independently or differently based on their needs. I have some people, as soon as we start talking about cancer, will break into tears, and usually I encourage them to come back for a second visit and sometimes bring a spouse or a friend with them so that there's two sets of ears listening, and that helps them get the information, plus they have a little emotional support with them, because I think it's important when you're undergoing a big operation like this that you have all your questions answered before you go to surgery.